Thank you, Rita. Okay. Well, we have heard a lot about artificial intelligence, about doctors, maybe just a question, possibly not quite understanding laboratory results. There are a lot of challenges, and I want to take a step back first and see where we are and how to proceed from there. Well, we can go back 20 years here, and already it was recognized this issue of translating our data to knowledge and to help our doctors to understand the test results. And that was in a time when labs were merging. Well, we are familiar with that still. Larger scales, a lot of data, and we should come out of the corner of only generating numbers. And well, people came together and thought about this, and all the vision then pointed to in the same direction. We should not only provide numbers, we should add value to these numbers. And even to a point that it was questioned, it was rather provocative, that we may not survive as clinical chemistry. Well, as we are here with a lot of people, we are still there, but it was the same thing pointing to in the same direction, add value to these test results. And also in the Netherlands, we had a 5 years plan. We should also move in a direction from doing only the tests to mingling with the doctors and adding value. And it resulted even in a guideline. I was involved in consultation. And I'm talking about consultation on a regular basis, not waiting for the telephone to ring, but being proactive. And if we look at ISO, it's even there. It's part of our profession to do this consultation thing. And a very recent paper from one of the working groups of IFLM, it's also, again, in the same direction. So we, as a laboratory field, we feel that we should work on this consultation thing. But are we willing doing that? Well, let's look at this. We talked about needs assessment. Let's go into a little bit about this needs assessment. Is there a need out there? Or are we only thinking that this is important for us? Maybe these doctors say, well, mind your own business, give us the numbers, that will be okay. Well, we do something about reflex testing, I think everyone does. This is something that is high volume. This will add a little bit to the only numbers. It can be automated, so we do that. And colleague Lippi made it more sophisticated in diagnosing or excluding heart attacks. Reflective testing is a means to organize and proactive do the consultation. It's adding tests, it's adding comments. It was introduced in about 2004. Well, if you don't know what it is, if you have an unexpected result, abnormal result, you might add, as a laboratory, some tests, in this case to exclude hemolysis, and then you might add a comment and a conclusion that it might be a benign hyperbilirubinemia, Gilbert syndrome. Well, there were a lot of papers on this reflective testing and show that it could be valuable. This is another means that we want to introduce in the very near future. The 1st of August, we want to start this as a sort of reflective testing on demand. So the doctors might tick this box, and then we will look at their lab results, and they are asked to add a question or what the problem is. Well, this is also a sort of needs assessment that has been done in England, in the UK, and they asked, what do you want as a doctor? Do you want to add tests by the laboratory or phone, or add a comment, or do nothing? And what you see here is that doing nothing is the least preferred by the doctors. Okay, and we did the same in the Netherlands with the same result. Again, pointing to the same in the same direction. Doctors do not want only numbers; they want an explanation and added value. So there is a need out there with doctors. And we just very recently, these are some preliminary results, for specialists. We wanted to know if specialists was, the last slide was about general practitioners, and we wanted to know if specialists had the same opinion. And here you see the same thing, that results only is the least preferred option. And they want comments, or these are all clinical cases, and we give an example of reflective testing. And this is preferred, comments. Maybe sometimes they want to be phoned before, but in most cases they do not want only the numbers. So there is a need out there with doctors. And we looked into, this is an old study we did, is there any added value, this is an outcome study. And we see that even we could, with this panel evaluation, we showed that there was an improved quality of care also. So it's not only a need, it's an added value in improved quality. Now about patients. What is the need assessment in patients? And they also have no problem with laboratory adding tests, as has been shown. And another thing that might even change the whole field is that patient will get their results. It's inevitable that with all these patient records being available, they will get access to their results. And as just has been explained, they will not understand these results. I think it has no use to communicate just the numbers to the patient. And in the Netherlands, this is a project that by 2020, all the patients will have access to their data, to their medical data. And 100 million euros has been provided by the ministry for all hospitals to get this done by 2020. Okay. And well, this also points to the same direction. Patients will get access, but won't understand the results. So we did a sort of a short trial with 40 patients, giving them the lab result, including an explanation in lay language with easy to understand comments and conclusions. And the question was, is it possible to make this understandable and do the patient like this? Well, as a shortcut, it was very much liked. Almost all patients like these reports and want to have them again. But this was done by hand, so of course it's impossible to do this in a larger volume. So we have in the EFLM the patient-focused laboratory medicine working group, and we also did a survey on a larger scale of patients like this, and it's again the same conclusion. They like this, they want to have it, and they think the laboratory, as far as they are specialists in this field, are accepted to give these comments. So there we are. Doctors want it, general practitioners want it, patients want it. We think that it's a very good thing to do, but are we doing it? And do we have an answer with these large volume laboratories to really proactively comment on all these test results? I think we don't have an answer yet. That's the problem. That's the challenge. And another problem is that in our laboratory we comment on hematology results, and one colleague makes very short comments, another long comments. So also in automating this, you have a harmonization of this commenting. So what is out there as solutions? Well, again, you have to look back. A lot of techniques and statistical techniques have been used, and well, you might recognize some of them, multivariate analysis techniques, but these are very complicated. There have been some expert systems. All systems that need large databases with calculations are also difficult to transfer from the one laboratory to the other. If one test changes, you have to recalculate everything. That makes it very rigid and difficult to apply. Well, there have been a lot of papers about this. These papers are becoming less numerous. The last years, I looked for them, 46 now in 2017. So there have not been really many applications for these very sophisticated systems. Well, you all know this application, but you all know that to apply this, you have to have very well calibrated tests. Only certain labs can do this, at least in the Netherlands. I think there are 5 laboratories. So it's difficult to apply these multivariate methods. It's not easy. So are there any new techniques out there that we could apply? Yes, there are some. These are rule-based systems that are more easy to handle and adapt to your needs in your laboratory. One system actually from the Netherlands is applied on a wider scale for drug-drug interactions in a pharmacy. And we are now working on an application for drug test interferences and to automatically generate comments when there is possibly an interference. That we all know that some drugs change your test results, and that might be an explanation for the abnormalities you see. And this is a system that we try to get working now as a proof of concept in 5 laboratories in the Netherlands. And then a comment will come on your report and alarming the doctor that the results might be abnormal because of the drugs used by the patient. It's very complicated because you have to link the database of the medication that has to be available. You have to have a database of all the patients and the drugs they use, and the test results, link them together in a special system and apply some rules. But it's now working in 1 hospital in the Netherlands. Another system that might be a solution is a ripple-down rules. Ripple-down rules can give more than one solution or true value. It's not a decision tree that ends in one decision, but might lead to more true decisions at a time, and it makes it possible to create comments. For instance, if you have a microcytic anemia with also a component of inflammation, it might make several rules true, and you can compose a comment based on that. And this is working. This is an Australian system, And the new thing is, and one of the messages I want to bring across here is that now large firms have identified this possibility and support this possibility. It's Philips that has linked this system to their LIS, and there are a few laboratories in the Netherlands that work with this. So it's working, and the link between your LIS needs to be rather sophisticated, because the system can give a signal that tests should be added and also that comments should be added. So it's a bidirectional connection, and also historical data are used. So it's looking back. And also, and that's a bigger initiative, I have no connection with any of these firms, and no interest whatsoever, only that Abbott wants to do a project together with, the EFLM working group. We are now discussing this as a possibility. Abbott also works together with this PKS Australian system, and sees the possibilities and wants to do a proof of concept trial. So these might be possibilities. But again, this is how it works. You link it to the LOAS, and reports can be linked to your system. So my message here is clear. If you look at the needs assessment that we talked about yesterday as a Western thing, the need is definitely out there. The doctors want it, the specialists, general practitioners want it, the patients want it. The patient will get access to the records, but will not understand our numbers. There are some solutions out there, and I think all these statistical systems are very complicated and impractical. Rule-based systems might be more flexible and easy to use. Big companies are now seeing the possibilities. So we should act on this and make it work. That's my conclusion. And that's the way to go from chemical to medical and really do it. That's the challenge. I thank you.